Do you want to prevent recurrent miscarriages, have healthy children, and have a happy home? Then you need to do these 3 things before you get married. If it's something you want to know, I know this is something you want to know and you should know. So just sit back and enjoy the video, okay? Hi Besties, welcome back to my YouTube channel. I'm Dr. Hilda and my YouTube channel is about health and lifestyle. If this is your first time stopping by this space, thank you so much for stopping by. I hope you enjoy my content and you subscribe. So in today's video, I'm talking about 3 tests that you definitely have to do before marriage to endeavor that you have a healthy relationship and give birth to healthy children. Without further ado, I'll just get into the video. So in no particular order, I'll just go ahead and list all the tests that you have to do. So you guys should just stay with me throughout this video because you don't want to miss any of these points. First test that I'm talking about is the genotype. So there are various types of genotype. There's the AA, there's AS, and there's SS. So there are different levels of compatibility. So someone who is AS cannot marry another person who is AS because they have a high probability of giving birth to a child that has SS, has sickle cell anemia. If you have a conversation with someone who has this illness, they will tell you the amount of pain they go through. It's really not worth it at all. In my experience of being a doctor, I come across patients and actually ask them, parents of children who have sickle cell anemia, I ask them, did you have a genotype test before you go marry? And they say yes, they did a genotype test. So let's all know that it's not just all about doing your genotype. You have to go to a very trusted place, and after doing that, you have to confirm at least in another place. Do it like twice because there can be errors, and if you're AS and you are just assuming that you're AA and you end up marrying someone who is AS and you have an SS child, at that point you really cannot do anything at that point. You just have to manage the situation. If you're AS, SS, the only person you can marry or that you're advised to marry is someone who has the genotype AA. So the second test that is very important is the blood group. So there are different types of blood group. There's the O, A, AB, and the rest of that. And there's also a rhesus factor that is usually attached to the blood group. It could be positive or negative. So this is very important that you know your blood group before marriage, especially for women. So if you are blood group O negative, that's for women, and you get married to someone who is blood group O positive, and when you get pregnant, your child takes the blood group of the father that's O positive, your child can actually develop an illness called hemolytic disease of the newborn. So the first child most times survives it, but after that first child, you keep on having recurrent miscarriages because your blood is going to be fighting against the blood of your child, and they'll be losing so much blood while they're in the womb, and they'll just keep on dying. So you don't want to be having recurrent miscarriages. That is why you need to know if you're blood group O negative or positive. So let me just put this out there. If you're blood group O negative, doesn't mean that you can't marry someone who is O positive. It's just that you have to know that when you're pregnant and during the course of a delivery, after delivery, you will need a particular injection. So you have to know all of that before you actually even get pregnant, so adequate plans can be made so you don't form those antibodies in your blood that would affect your child. So I have a full video talking about this, so I'll just leave the card above so you can watch it if you're yet to see it. So I know you have been watching, and this is a very good time to subscribe if you're yet. So yeah, thank you for subscribing. I'll also give this video a thumbs up if you're enjoying it. The third test I'll be talking about that you have to do before you get married is viral screening. So you need to screen for HIV, hepatitis B, hepatitis C, and all of that. That's because this viral illness can be transmitted from an individual to another during sexual intercourse. So if an individual is positive that has HIV virus, it doesn't mean that person cannot get married to someone who is HIV negative. There's just some precautions that have to be taken. That person who is HIV positive has to be on highly active antiretroviral drugs, that's the medications for HIV, so that the viral load is actually very low. When it's actually very low and undetectable, it will not be transmitted to the other person, and the other person may need some drugs to be on also. So you don't want to just get married and you realize one day that you're actually positive. You didn't even know you're positive and you already transmitted this virus to another person. So these are important tests that you have to do even from the dating period. Don't wait till you're getting married, because when you're getting married, at that time there will be a lot of, your judgment might be clouded. You guys might be so much in love with each other that you do not want to let go, and at that point you now start bargaining, compromising, be like, okay, since I'm AS and you're also AS, we'll not have children, and we know that that might not be realistic if you actually want to have children. So it's very important that you actually run this test very early in your relationship and actually know how to plan how your marriage will go, okay? There are other tests that are also very important for you to run, like your kidney function test, eye checkup, and the rest of that. But these 3 tests that I just highlighted, they have to be done before marriage to endeavor that you have a healthy relationship with your partner. So if you enjoyed watching this video and you learned from this video, please give this video a thumbs up. If you have any question regarding anything I spoke about, feel free to leave me in the comment section. And if you have suggestions on similar videos you want to know, just leave them in the comment section. Bye, and I'll see you in my next video.
Go, go, go.